Well, it's a joy to be here. I've just already had a great time. I don't know about you all, but I guess that'll depend on how well I do with this next part, how great a time you'll have. But it's just a pleasure for me to come. I said to David, I get out in the community, my batteries get recharged, hearing the students, seeing what's going on. And what you heard about tonight here at the University of Cincinnati is happening on 279 different campuses across the U.S. And God's moving in the hearts of medical students, dental students, CMDAs beginning to reach back and realizing with what's going on in healthcare, what we're seeing on the ethical front, which we'll be talking about tonight, that either we're going to hang together or we're going to hang separately, especially on this issue of right of conscience, which is so important that we're going to address tonight. And so the Fellowship of Christian Physician Assistants just moved under CMDA. The Fellowship of Christian Physical Therapists is now part of CMDA. We're working closer with Christian Pharmacy Fellowship, Nurses Christian Fellowship, in a lot of different areas, realizing that we need to work together where we can for the glory of God and for Christians in healthcare professions. CMDA, many of you are familiar with, a few of you may not be, but it's growing, it's developing. Some days I wake up and tell God to slow down. I'm having trouble keeping up. It's just been thrilling to see what God's doing as we motivate, train, and equip Christian healthcare professionals to glorify God with the vision of transformed healthcare professionals transforming the world. And as I stated downstairs, I think one of the best mission fields left in this country and overseas is the one that God has given to Christian healthcare professionals. CMDA really has four main key result areas. One's evangelism and discipleship, and that's what our campus ministries fall under, and side by side, and marriage enrichments weekend, and singles ministries, and all sorts of things that we do among our 50 different outreaches. Secondly is service, and that is in domestic and global missions. And God is just, as I mentioned downstairs, there's a renaissance going on in medical missions like I've never experienced before. And God's opening doors like never before. We had 700 missionaries in Greece last spring for our annual Continuing Medical and Dental Education Conference and Spiritual Renewal. We are seeing at the Global Missions Health Conference, which will be in Louisville the second weekend of November. If you've not been to that, you should go. There's 2,500 in attendance, 150 mission organizations, 105 workshops, and last year over 950 people came forward to make commitments to serve the Lord. We're now trying to duplicate that. I'm working on it right now to do one in Dallas and one on the West Coast. So you can be in prayer about that. Medical Education International, our group that uses academics to get into difficult-to-access countries. You'll be interested in this story. A few years ago, we went into Macedonia. Remember the Macedonian call? The country still exists. And through that actually came an acquaintance of the Minister of Health. He was so excited and thrilled in this Muslim country, largely Muslim, about what God was doing through our members to train their healthcare professionals, that he turned to us and said, I'll pay the way for anybody that wants to come and pay all their expenses while they're here. The first year we sent 15. Next year we sent about 40. This year he's asked for 100 individual healthcare professionals. You want to go to Macedonia? I got a way you can get there. It won't cost you a penny. And building relationships, often specialists that are going in, building relationships, having an opportunity to share the gospel and disciple people. So I could go on and talk about this. We just trained 60 new medical missionaries in August. We're going to have another training because the demand's so great in March. So just lots of things going on in the whole area of service, and God just stirring people's hearts, both in this country and overseas. And the third area, of course, is equipping. That's putting the resources and the services in the hands of CMDA, its members and Christian doctors across the country to enable them to do their job well. And one of the things I'm particularly excited about is we're just next week coming out with the video curriculum, a 14-part video curriculum called Grace Prescriptions, really integrating your faith into your practice. How do you take a spiritual history? How do you share faith flags, tell faith stories? It's the saline solution that we did over a decade ago on steroids. Lots of accountability, small group work, and the initial conferences we did trying out this curriculum were just phenomenal feedback. So you may want to get involved in that. And then what we're going to talk about tonight, public policy. You know, CMDA probably spends less than 5% of their time in this area because all this stuff's going to pass away. And what we're doing in students' and graduates' hearts and helping them grow in the Lord and use their profession as a ministry is much more important. But at the same time, we have a responsibility as Christian healthcare professionals to speak truth into our culture. And speaking out on lots of different issues over the years. Just last month, I spent a week in New Jersey and Connecticut fighting physician-assisted suicide, training pastors, training priests, training healthcare professionals across the state where they're trying to legalize this in both states. I'll be in Montana doing the same thing in November. But what we're going to talk about this evening is really the most important thing, because I see this as the greatest attack to really try to force Christian healthcare professionals out of medicine. There's people that don't like us around. And defending right of conscience, the whole concept of religious liberty is going to affect all of us, whether you're in healthcare or not. If you've been watching the news, you've heard about the pastors down in Houston asked to turn over their messages about what they're saying. This is going to be a tremendous battle, and that's why I'd rather be preaching a sermon or doing something else tonight, but felt so strongly that you needed to be equipped to know how to speak out on this around the water fountain, how to defend this very important right that our founding fathers put in place to protect us and all the generations before us and after us. So let's dig into it. I could be talking about Ebola tonight. That's all I've been talking about for the last 6 weeks on the media. But this is much more important. So let's get into it. And I better turn this thing on. There we go. Except that monitor back there is not on. If you could turn it on, you'd be of great help to me. I'm actually running my computer and one up there at the same time. So if I look confused, it's because I am. Let's look at the definition. What do we mean by this freedom, the right of conscience? The freedom to practice health care or any part of your religion in accordance with your deeply held religious, moral, or ethical convictions. So this applies to the workplace, whether it's health care or whether it's something else. And this is a very basic right. I'm going to be turning around a lot here. Now, don't be confused, and it's easy to be on this topic. Healthcare right of conscience is not refusing to treat someone because you don't like them. We're accused of this all the time when I debate people on this. You just don't want to take care of people that you disagree with. Just because all of us take care of patients, we don't approve of their behavior, whether they're alcoholics, drug addicts, they beat their wife. I remember in medical school, I went and spent a summer at Eddyville, Kentucky, where the maximum security penitentiary was, and I worked there for the summer and made rounds on death row. I didn't agree with any of those patients and how they had lived their lifestyle, but that's not what we're talking about. Right of conscience is exercised when a healthcare professional is being asked or required to participate in or facilitate some way in action they believe violates their ethical, moral, or religious beliefs. Let me give you an example. You've just taken care of somebody in your practice who's an alcoholic, and you've been counseling and trying to help them work through this as well as all the health problems that have come through it. And it's the last patient of the day, and you're getting ready to go home, and they say, "Hey, listen, doc, by the way, could you drop me off by the package store on the way home?" Would you do that? I wouldn't. Why? Because I am facilitating something that I know is hurting that person. Or you could loan your gun to someone who's suicidal that you see in your practice. You would be facilitating what they were doing. And unfortunately, that's what's happening in this country on some of these ethical and moral issues that we're facing. But I don't agree. Yes, I don't agree. Protection of someone's right to object based on these things doesn't equate that you agree with them. For example, I would defend a Muslim's right to worship at the mosque. That's religious freedom in our country. It's not just religious freedom for me, it's religious freedom for anyone. Indeed, we must pay special attention protecting the rights of those who are in a small minority and who need protection. Now, that doesn't mean that every conscience right claim is true. There was a prisoner who actually claimed that he wanted his wife to be able to come into his cell once a week because it was his right, a right of conscience, to sleep with his wife at least once a week. The validity of the claim can be judged in light of the prevalence of the belief in society and the individual pattern of adherence to that belief. But that's not where the big issue is. The big issue is in this area. Let's go and go back to the beginning. This is not a new issue. Before Hippocrates, doctors both killed and cured. Did you know that? The physician-assisted suicide is not a new thing. In fact, you think you're nervous to go in the doctor. You imagine what it was like back then. Somebody paid them a little bit more money, they'd knock you off. And the Hippocratic Oath is very much about right of conscience. It's about, I will neither give a deadly drug to anybody who asked for it, nor I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. These are all matters of conscience. You don't have to fear me as a healthcare professional because I'm going to do what's in your best interest and within my ethical framework. And unfortunately, what's happening now in America is that there's a desire to, let me say it this way, I'll say that later. It'll come. I'm going to say it to you in a minute. Well, they want to emasculate our consciences. Is that a good way to put it? I've said that actually in the media. It usually gets people's attention. What right are we talking about? Well, there's the Bill of Rights, and Congress shall make no law respecting religion or prohibiting the free exercise thereof. Right of conscience is actually guaranteed in the Constitution. And we need to remember that our country was founded by dissenters, people who walked to a different step. Our founding fathers fought a revolutionary notion that they put forth that the exercise of conscience and freedom of religion are inviolable rights, that they are given to us by God, and there is a higher authority than our government. And if you go back and look at James Madison actually wrote that part of the Bill of Rights. In the first edition of that, here's what it said: "The civil rights of none shall be abridged on account of religious belief or worship, nor shall any national religion be established, nor shall the full and equal rights of conscience be in any manner or on any pretext infringed." I wish they had left it like that. It is so clear. But between the House and the Senate, they said we need to make it briefer. They went back and forth. I've actually got all the congressional records that talk about that, and finally said, no, we can make it shorter and say the exact same thing. They didn't mean a different meaning, but they wanted to shorten it, and that's what they did, and that's the version that we have in our Constitution. But this is the unabridged version, which tells us very clearly what our right is. Thomas Jefferson said the same thing. The right of conscience we never submitted. We could not submit. We are answerable for them to our God. Now, Thomas Jefferson wasn't a Christian. He was a deist, but he felt very strongly about this. He also said, I consider the government of the United States to be interdicted by the Constitution from intermeddling with the religious institutions, their doctrines, their disciplines, or their exercises. He was very clear that this was a basic fundamental right. James Madison went on and said, conscience is the most sacred of all property, the exercise of that being a natural and unalienable right. It can't be much more plainer than that. He also went on to say, the religion of every man is left to the conviction and conscience of every man. It is the right of every man to exercise it as he may dictate. So it's very clear, and people that are trying to change this, trying to muddle, that's not really what the Constitution means. That's not really the Bill of Rights. But the bottom line is that is what it means. We also have protection in federal law of some sort. A lot of things that have tried to be done. First of all, is the Church Amendment, way back in 1973, right after Roe versus Wade, and essentially gives broad protection for religious expression in the workplace. We have the Public Health Service Act, which also protects people from having to participate in abortions. We have Medicare and Medicaid does this as well. There's things in there saying that you can't require abortion training in the ACGME law. ACGME is the group that actually gives accreditation for medical training, and they tried to make it required among OBGYN residents to be involved and trained in abortions, and the government prevented that. The Weldon Amendment, back in 2004, covers any healthcare professional, as well as hospitals, HMOs, health insurance plans, and any other kind of healthcare facility, organization, or plan. That's a quote from it, saying that you can't be forced to participate, refer for, pay for, provide coverage of, or whatever for abortion. So these federal laws are definitely in place. But the problem is that they are limited to federally funded programs. If you're not getting money from the government, these things don't apply to you. And secondly, there's no enforcement provision for any of them, except to say they will take away federal funds. There's no right of personal suing someone because they've taken away your rights. And that's kind of like having speed limits and no state police. Be honest with me, how fast would you drive, right? And that's the problem that we're facing on right of conscience, because yes, these are there. They have never taken away funds from any organization for stripping someone of their right of conscience. What about state laws? There are state laws of conscience in 45 different states across the country. State by state laws, you can actually find them online at this address, consciencelaws.org. I actually looked up for Ohio, and Ohio says very clearly that you cannot force someone to participate in abortion, refer for abortion, or whatever. Unfortunately, it doesn't protect against anything else, and there's many more issues than just abortion, and we need to realize that. The AMA speaks out against this. The American Medical Association reaffirms that neither physician, hospital, nor hospital personnel shall be required to perform any act violative of personal held moral beliefs. In these circumstances, good medical practice requires only that the physician or other professional withdraw from the case so long as withdrawal is consistent with good medical practice. Also, except in emergencies, physicians shall be free to choose whom to serve, with whom to associate, and the environment in which to provide medical care. Sounds really good, doesn't it? Trouble is, they're not enforcing any of it. In fact, they've actually advocated before Congress for exactly the opposite. But it is still in the AMA Code of Medical Ethics, so you can quote it. Also, the International Covenant of the UN. Everyone shall have the right to freedom of thought, conscience, and religion. This right shall include freedom to have or to adopt a religion or belief of his choice, and freedom either individually or in community with others and in public or private to manifest his religion or belief in worship, observance, practice, and teaching. This saved my bacon in Sudan. When I was with Samaritan's Purse, we were doing relief work. It was actually an epidemic of relapsing fever, and we were up in the middle of nowhere. This lice-borne disease, 40% mortality rate, 400 fresh graves behind the village in a city, a little village of about 2,000 people when we arrived. And we were able to get it under control with dusting and antibiotics and all sorts of things. Well, Doctors Without Borders was just down from us, and we'd gotten there first and gotten to the epicenter, and so they decided they wanted our work site because they get better publicity. You may see I have a few feelings about Doctors Without Borders, but I'm trying to deal with it. So they complained to the UN that we were proselytizing because we were showing the Jesus film at night. You wouldn't believe it. We were out in the middle of nowhere with a generator, a screen, and a projector, not video back in those days. And there were 1,000, 1,500 people there weeping, watching the Jesus film up there in these tribal areas. And so I got called in. And at that time, the only way to get to where we were, you had to be on a UN plane because the northern Sudan shot you down if your plane wasn't a UN plane. I got called in and said, "You've been proselytizing, you have to stop that, and if you don't stop that, we will no longer fly you in." Fortunately, one of my new staff that came out from Canada just finished his degree in law, and he says, "I think it says something about that in the UN Charter." So the next day, with a smile on my face, I went in and I said, "I don't understand how you can violate your own charter when you're working for this organization." And that was the last we heard of it. So keep this one in your back pocket if you're doing relief work. The World Medical Association, the physician should be free to make clinical and ethical judgments without inappropriate outside interference. The European Convention on Human Rights says the same thing. So you can go through organization after American Pharmacists Association. All of these groups have clear conviction of conscience. The Nurses Association, the American Society of Health System Pharmacists, and the list just goes on and on and on, that this is the issue. So with all these protections, why in the world are we talking about this tonight? Because right of conscience is under attack. And it's coming from more directions every day. And we've seen this with the Affordable Care Act and all that's going on at the national level. We'll talk a little bit about that. It's really started out of the abortion corner, but it's now spreading. Planned Parenthood calls this a threat to reproductive rights. You can read it right on their website. They don't call it the right of conscience. They call it the right of refusal. They talk about health-related decisions made between a provider and a patient should be made on the personal welfare and healthcare needs of the patient, not the morals or beliefs of caregivers. And go on to say, while we firmly believe that all people have a right to their own opinions and moral beliefs, it is unethical for healthcare providers to stand in the way of a woman's access to safe, legal, and professional healthcare. And that is the message they're preaching, and unfortunately is being listened to by many in authoritative places. And you can see here Planned Parenthood, it's pregnancy-related services. The vast majority, of course, of what they do is abortions. This year is 2010, 329,000 abortions and 841 adoption referrals. They tout their prenatal services and all the rest. 38% of their money comes from the government. To say that is a patient's very ability to choose these procedures or medications is dependent upon the existence of a doctor who's willing to facilitate whatever choice the patient makes. Consequently, a doctor's unwillingness to act in a particular way due to her conscience becomes a barrier to a patient's self-realization. So there's a lot of efforts underway to abolish abortion laws. The Abortion Access Project, the ACLU's got things going on, the Reproductive Freedom Project, the Pro-Choice Resource Center. I could just give you a list after list of well-funded, hard-working groups that are trying to take away our right of conscience. And then, of course, Planned Parenthood. And we could go through this long history. I'm not going to go through it, but just to make a brief comment about it, it's been going on for a long time. 1997 in Alaska, there was a court case. Private hospital was receiving state funds. They said that they were private. They didn't want to be involved in abortion, and the state Supreme Court said, nope, sorry, you have to because you are a pseudo-public institution because you're in the state, and therefore you have to do abortions. California and Benitez versus North Coast. This was actually a Christian OBGYN practice. They had a lady come to their practice who was a lesbian. She wanted to get pregnant and was having fertility problems. And they said, sorry, we will be happy to work you up and try to understand your fertility problem, but we will not help you do actually creating and implanting an embryo in your womb. It's against our religious beliefs. They told her that. She agreed to it. They put it in the chart. They referred her to another practice that did that. She had a child, turned around and sued them. It went all the way to the Supreme Court of California, and they said, quote, if you provide a service for one patient, you must provide it for all patients. In other words, you cannot make a decision as a healthcare professional to say, I won't do this for one patient if I won't do it for another. We see what's happened in Illinois with the former governor who took away all the pharmacists. He's now paying a price for something else, but he took away their rights, pharmacy regs in Washington. You can just go down the list, but let's get to more modern times and talk about what's happened at ACOG. This was the pivotal case that put the warning lights and the sirens off for everybody involved in healthcare. The American College of OBGYN in Committee Opinion number 385 came out and said this about right of conscience, and this is one of our professional organizations. Patient autonomy is the final arbitrator of treatment. It's not you, if you're a healthcare professional. The right to demand treatment equals the right to refuse treatment. Think about that for a second. That is huge. This is a professional organization. I wish I could have been there on the discussions. I'd say, you mean if a woman comes into you and says, I want a C-section 3 weeks before my due date because I need to go on vacation, you would do it? Because that's what they're saying, aren't they? If they demand treatment, it is no different than them refusing a treatment that you suggest. This is an earthquake on how we've looked at these issues. Right of conscience, they said, is just a personal opinion. The moral obligation to a patient overrides right of conscience. Inconvenience that you impose on the patients, it imposes your beliefs on the patients. So if you inconvenience them, you've imposed your beliefs on them. Does that mean if I go to Walmart and they tell me I have to go to Sears to get something, they've imposed their beliefs on me? But that's what they're saying, that just by the fact you say, I'm sorry, I don't provide that service, they can get you in trouble. Patients' concept of well-being trumps physicians must refer for abortion. If they can't timely refer, they must provide. And those who refuse to provide abortions should only practice in areas where abortion services exist. Now think about that for a minute. I mean, how many of our members practice in underserved areas where abortion may not be available? So they need to pack up and move to the city where this may be available. It's huge what they said, and people begin taking notice. Unfortunately, the American Board of Obstetrics and Gynecology a few months later came out and said that recertification for OBGYNs was contingent on their compliance with all of ACOG's ethical principles, including this last statement. And you see where this is going? First, it's an opinion, and then it's you're not going to get your license. And unfortunately, there was enough pressure put on them that they reversed it within about 2 or 3 weeks on this. But this is what resulted in Health and Human Services policy under the Bush administration. It came effective January 20th, 2009. It said this, just this simple statement: you can't discriminate in the employment, promotion, termination, or the extension of staff or other privileges to any physician or other healthcare personnel because you perform, assisted in the performance, refuse to perform, or refuse to assist in the performance of any lawful health service or research activity on the grounds that his performance or assistance in performance of such service or activity, sounds like the government, doesn't it, would be contrary to his religious beliefs or moral convictions, or because the religious beliefs or moral convictions concerning such activity themselves. Essentially giving blanket protection, not just for abortion, but for anything. They actually put in place a hotline you could call. There were penalties, and for the first time there was enforcement of this. And everybody goes, wow, that's great. Well, then there was an anaphylactic reaction by pro-abortion groups, some politicians, and a lot of the media, and false claims that women will not be allowed contraception. The receptionist won't even let you get into the practice. There were media blitz about this, and it was all over the media, and legal action was taken. We actually filed a amicus curiae brief on this case. It was Planned Parenthood, ACLU, 7 state attorney generals filed suit in Connecticut in a friendly court to overturn this. But somebody else came to the rescue and overturned. It was overturned fairly quickly. In February 2009, President Obama announced he will rescind the regulation. There was 30-day public notice and comment period. Over 300,000 comments came in, one of the largest number of comments they received on any issue. All references, though, to the regulation were immediately taken off the HHS website even before it was rescinded. And then in 2011, February, the whole thing was gutted and really has no enforcement, no hotline, and was changed completely in what they said, and that was the end of it. We've also seen the same thing in the Healthcare Reform Act, unfortunately. The Church, Weldon, and all the other laws applying to right of conscience only apply to annual Health and Human Service appropriations, and the Healthcare Reform Act doesn't come under their annual HHS appropriations. So all that protection is gone, and that's of great concern. The reform bill only protects physicians from insurance companies coercing them to do abortions. I've never heard of that. I don't know if you have, that an insurance company coerced someone to do abortions. That's what's in the law. There were over 21 attempts to put right of conscience protection within the Health Care Reform Act, and unfortunately, none of them were effective. So there's no protection for other professionals, and there's no protection on any other issues other than that one thing. So it's kind of like leaving your practice and not taking an insurance tail. Unfortunately, this area we have no protection at all. But the big question is, okay, Dave, that may be all true, but is this really affecting healthcare professionals? Well, we determined to find out, and CMDA actually did a faith-focused healthcare professional survey. We hired a group to do that, and to see what they would say. And here's what we found out. 40% of people reported, healthcare professionals reported being pressured to compromise their convictions, either during their practice or during their training. 43% know someone else who's been pressured. 1 in 4, 24% have lost a position, a promotion, or compensation as a result. Now that is huge because we didn't just survey OBGYNs, family practice docs, primary care. We were surveying ophthalmologists, everybody you can imagine in healthcare, who many of these people and other specialties may not be affected by this issue as much. And so this is a huge issue. 88% of people that we surveyed say they think the problem's getting worse, and this was done a few years ago. And I suspect the problem's even greater now. And we continue to see problems. 2010, you may have seen this case. It was Alliance Defense Fund got involved with this nurse who came to work and said there was an emergency abortion and she needed to participate. Mrs. DeCarlo, and under threat of disciplinary action, including possible termination and loss of her license, Alliance Defense Fund took the case, put out the church amendment, and they said, sorry, the church amendment doesn't have any right of private remedy, and she quit her job after that. 12 nurses at the University of Maryland, New Jersey, faced the same thing. They worked in an outpatient surgical unit, and they said to them, you've got to come and be trained to do abortions. They said that violates our religious convictions and our moral convictions. And fortunately, because it was a public institution, backed down, and they actually had a settlement, and they didn't have to do it. But it's still coming up. The HHS mandate, of course, is a huge issue, and we've been hearing a lot about it in the news, from the Hobby Lobby case to you name it. And Secretary of Health and Human Services was given an enormous amount of authority on the Affordable Care Act and authority to decide what preventative care coverage was. And of course, what came down was that we must provide all FDA-approved contraceptives. Well, I went a little too far there, sorry. Yeah. And with just stipulations which have not been satisfactory to those involved. Why contraceptives is not just something that would affect someone who doesn't believe in dispensing contraceptives, and that can be both Catholics as well as Protestants. We have some of our members that don't dispense contraceptives. But also the fact that a couple of these contraceptives are actually abortifacients, and that's what the Hobby Lobby whole issue was over. So it's still over 100 cases in the courts that are now winding their way through, and how those are decided are going to have an enormous impact on you and me. We're involved in multiple amicus curiae briefs, working with the Alliance Defense Fund, the Christian Legal Association, and other groups, giving them standing to represent you in these cases. And we need to be in prayer as this goes forward. So what do Americans think about the issue? Well, we actually went out and did a survey to find out, scientific survey. 88% of Americans say it's important they have a similar set of moral beliefs as their healthcare professional. That's what I've said many times in the media. They'll say, well, doesn't a woman have a right to get her abortion? I said, doesn't someone who doesn't want an abortion have a right to have a healthcare professional who's not doing them? My daughter, when she delivered her baby, didn't want her OBGYN aborting a baby in one room while she was delivering her in the other. And she has a right to pick someone like that. 87% oppose forcing professionals to violate their moral objections. And here's the one I love to tout. Not this one, the next one. 63 support conscience regulations, so a majority of people think that we should be doing this. And so protecting healthcare professionals, but 54% are less likely to vote for their congressman that oppose right of conscience. When I testified on the Hill, I said that. It was so much fun, because this could be dangerous for you. And you better listen, because there's a lot of people out there going to change their vote on this single issue if you go the wrong direction. And it's important information to know. We actually, the polling company is the group we used. We had a national press conference at the National Press Club in Washington, announced these findings, and trying to bring public pressure on this whole issue. Other people have talked about this. Martin Luther King, which is a great person to quote, he said this: on some positions, courtesy asks the question, is it safe? Expediency asks the question, is it politic? Vanity asks the question, is it popular? But conscience asks the question, is it right? And there comes a time when one must take a position that's neither safe nor politic nor popular, but because it's right. Wow. Amen to that. We can even quote our movies and books. To Kill a Mockingbird, Harper Lee, the one thing that doesn't abide by majority rule is a person's conscience. From that famous movie. If we got, this was actually by Linda Rankin, a bioethicist, University of Tennessee, a few years ago. She said this, and I thought it was so eloquent: if we don't protect personal integrity, we would go down a dangerous avenue. By taking a professional license, you do not step out of your personal morality. You have taken on an additional responsibility, but that does not mean you've given up your integrity as a person. That's worth jotting down. If you want to get this PowerPoint, it's up on our website. Put your name on it. Share it with everybody you know. Claim credit for it. That's fine. I don't care. Just use it. I work for all you guys anyway. This is work for hire, as they say. Must the citizen ever for a moment or in the least degree resign his conscience to the legislature? This is Henry David Thoreau. Why has every man a conscience then? I think that we should be men first and subjects afterwards. The only obligation which I have a right to assume, is to do at any time what I think is right. Conscience in healthcare. Is our healthcare system in need of more conscience-driven doctors or more ethically neutered doctors? That's how I normally say it. That's a powerful statement. You try to find strong words that kind of hit you right in the face. Ethically neutered. Nobody wants to be neutered, so it works pretty well. Do we want medical schools to systematically strip our future doctors from any and all religious and ethical convictions that have not been approved by the state? And then remind them of this: your doctor's conscience may someday be the last line of protection between you and those who would profit from your early death. And that's true with what's happening on the physician-assisted suicide. I'm going to dig in just briefly into an area that I think is very important, and we sometimes, as even Christian healthcare professionals, wrestle with. And that is the issue of moral complicity. Let me go back one slide. I went too fast. What does referral mean? I have a patient, and I'm going to refer them to another doctor. You have a patient. You're going to refer them to another healthcare professional. It means I endorse the competency, the judgment, and the ethics of the doctor whom I'm referring to. I'm not going to refer someone to someone I don't trust. I enter into a professional relationship with that doctor. I will receive a report back from them, and I believe they will do no harm. That's why I don't refer. I wouldn't refer for something like this. And CMDA actually put together a great statement. It's on our website on moral complicity. What does it mean to be moral complicit in another act? It's the culpable association with or participation in a wrongful act. The use of information, technology, materials obtained through immoral means, using, rewarding, profiting, perpetuating, justifying, or ignoring past or present evil. enabling or facilitating future immoral acts. And we must strive to never commit evil ourselves, nor should we participate in it or encourage it in others. So how do we handle this? Ask the students that are here. Because much of what you have in your anatomy book was obtained that way. They used to rob graves and do dissections. So how do we deal with it? Well, we need to understand, first of all, the biblical guidelines on this. And here's what the Bible says. We must avoid evil. We must never do evil that good may come. We must oppose evil, and we should separate ourselves from evil. We can't totally separate ourselves from evil over in 1 Corinthians 5, 9, and 10. We should overcome evil with good. We should seek wisdom. So how do we actually make that work? First of all, we have to look at our intent. Our motives must always be to promote good and never to promote evil. Secondly, the magnitude. Some evil acts are so heinous that any association with them is unacceptable. A good example of that is what happened in Nazi Germany when they used to do research by putting people to death, putting people in freezing cold water and see how long it took them to die so they could better make protective garments for their own flyers. Things like that. This was terrible evil that they were doing. The timing. Passage of time may diminish complicity with evil, though it does not diminish the evil nature of the original act. They robbed graves 250 years ago. And so that's not something that is continuing. It's not something we're perpetuating. We can't change what happened. We don't agree with what happened. That doesn't mean we can't study anatomy. The proximity of the issue. A greater degree of association with evil acts increases your culpability. The knowledge that an original act was evil and knowledge that a subsequent act is associated with that act are both required for culpability. And certitude, a great degree of certainty that the original action was evil, increases complicity. I get phone calls that deal with this all the time. I'll get a call from someone and say, Dr. Stevens, I understand that this vaccine that they want to give my child was made in a fetal cell culture from 1963. Should I take it or not? And this is what I went through making the decision, and what our board went through and our ethics committee making the decision about that, because nobody's really certain whether that fetal cell culture came from a spontaneous abortion or a induced abortion. They're not doing this anymore. It's been 40, 50 years ago. And so I said, for my grandchildren, here's what I would do. And the organization has said is that it's okay to do that. If we had another option, we should take it. So how do we boil this down? Moral complicity with evil does not exist when all the following conditions are satisfied. Our intent is for good. The association with past or present evil is sufficiently uncertain, or the act is sufficiently distanced from the original evil act. And the action does not reward, perpetuate, justify, cooperate with, or ignore the original evil. That's a statement you should jot down, put on a piece of paper in your desk when you're looking at some of these things. Unfortunately, you're looking at Abraham Lincoln, but there it is. And it's available on the website. And it's in this PowerPoint and also on our website. And a lot of thinking went into this, but it really helps me, and I know it'll help you working through these issues. Because the great pressure already is coming on. Okay, if you don't do it, you need to refer for it. And how do you defend yourself? And here's the way to do it. President Lincoln, actually, in his Cooper Union address, was addressing the issue of slavery, but you could take what he said and substitute one word, and you'd be talking about what we're talking about tonight. He said this: what will convince them, this and this only, to cease to call slavery wrong and join them it is right? Right of conscience or abortion or physician-assisted suicide is wrong and join them is right. And this must be done thoroughly, done in acts as well as words. Silence will not be tolerated. We must place ourselves avowedly with them. The whole atmosphere must be disinfected from all taint of opposition to slavery before they will cease to believe that all their troubles proceed from us. You know what happens on these ethical issues? I've been doing this for 20 years now, and I see it. First, they want you to allow it. Then they want you to endorse it. Then they want you to participate in it. That is the natural progressions. It's not enough that you allowed physician-assisted suicide. The next step will come is you've got to endorse it and say, yes, it's an option, it's a good thing. And then you'll be referring for it, or maybe someday even required to give the pills. And that's what happens when we talk about all these different issues where right of conscience applies to. I'm going to finish with this. It's one of the best arguments, and it actually came from a guy who's an atheist, a pro-choice atheist. He identified himself as that when he wrote to the LA Times in 2008. And he said this: the extent to which an institution seeks to expunge individual conscience and moral autonomy is the extent to which it's totalitarian and dangerous. The idea that I resign my conscience to the institution or to the state is perhaps the single most pernicious notion in human history. It is the heart of wars and genocides of this century and the last. And if you want to think about what could happen in this country, you just look what's happened in other countries and how much further some of them are down the road and how quickly we're trying to catch up. There's lots of good resources out there. We have created a special website just on right of conscience. It's called freedom2care.org. There's new stuff on it all the time. You can register there, and they will keep you up to date on what had happened. It is now the official site for 50 different organizations on this issue. It's education and mobilization, blogs, Twitter, Facebook, polls, surveys, ability. You can go on there and say, I want to write my congressman about that. So it'll give you a letter that you can just sign, and it'll tell you who your congressman or senator is and send it automatically to them once you click it, or you can customize the letter and send it yourself. It makes it very easy to speak out on this issue and to keep you up to date. And then there's lots of different resources beside Freedom to Care, the CMDA website, consciouncelaws.org, and more. We're out of time. Thank you for coming. David, thank you for letting us be here in the church. God bless you.